and we're recording, and it's Phil here, Testicular Cancer UK, with an interview in our little series, This Is Me. But it's not about me. Today is about Sharon and her son Robert. A bit of a extraordinary case, really. Well, it is, I think, because Sharon's son has a learning difficulty and a condition called Fragile X, which I'm sure she's going to explain all to us. But this is really more of an interview with Sharon because Sharon obviously is Robert's mother, and Robert's not able to talk. So, but Sharon had a bit of a time with testicular cancer, the diagnosis, and a lot of up and downs through her. So we're going to talk about testicular cancer diagnosis and treatment for people with autism, Fragile X, or learning difficulties. But Sharon's also going to tell us her story about the bit of a battle she had to get Robert through his treatment. So tell us where, well, we know you're not called Sharon. Where are you from, Sharon?
I'm from Gateshead.
Yeah, it's up in Newcastle, but anybody outside the UK, that's up in Newcastle, up in the north. Lovely city, lovely people, amazing people, some of the best people in the world. Geordies, as they're called. Do you know why they're called Geordies, Sharon?
I've got no idea.
Oh, all right. Good
That's what
start.
that's one for Google search, I think, Phil.
Yeah, it might have something to do with Denmark or something, mightn't it? Because you're Danish heritage. But anyway, okay, so Sharon, your son Robert has got Fragile X and he can't talk anymore. So tell us about Robert and tell us about how you first diagnosed.
Well, we first discovered Robert's tumour on his left testicle about 3 years ago now. His testicle was huge, very heavy. It was so like it felt like it had been through like a masher and it had come out like a different shape.
Right.
We took him to the hospital and we were sent over to Newcastle, and we were told after an ultrasound scan that they were pretty sure that he had testicular cancer.
Right.
He had the operation where he had his testicle removed, which was fairly straightforward. And then they realised that they needed to get some more blood off him. Now, Robert won't sit and have a blood test taken, even though it's a quick procedure.
He's got Fragile X, Sharon. What could you tell us what that is?
Basically, he has a genetic fault on the end of his X chromosome. He has too much genetic material. He doesn't produce a protein called FMRP1, which basically it causes learning disabilities. He has a lot of behaviour problems. I carry the fault, so I actually passed it on to Robert when I became pregnant with him.
Right.
Robert's severely affected from it. I mean, you can have various levels of disability with it, but Robert's actually fairly severely affected with it.
Right.
So when it came down to Robert having treatment or procedures done, it became extremely complicated.
Right.
Just to have a simple blood draw, Robert wouldn't sit in the chair and allow somebody to come to put a needle into his arm. So basically, Robert had to be put under anaesthetic for any blood draws and also for any scans that he had.
Right.
Because he had to have a CT scan.
So why would Robert would lash out and he can't communicate, can he? I know he can't communicate as in talk like we can. So
yeah.
his way of communicating is to push and to scream type.
Yeah, but we were in the height of COVID at the time, so you can imagine all these doctors, nurses wearing face masks and
Yeah.
like the blue masks and
Yeah.
PPE, and he didn't know who these people were. He was in an unfamiliar environment being in the hospital, so he was pretty scared when he was going in, and we had like retching, vomiting and stuff like that. But Robert also hair pulls.
Right.
So anybody in front of him bending down trying to place a needle in his arm or his hand, he would go for the hair, he would go for the face, which means pulling off the protective wear for COVID.
Yeah.
He bites himself quite badly on the back of his hand. He would slap you, he would pull at the clothing. So any simple procedure for Robert, like a blood draw or a CT scan, was a million times harder. So every procedure that Robert had to have was all done under general anaesthetic.
So obviously he's a grown man as well, so he's strong.
Yeah, he was 30 years old at the time, and I mean, he's only 5'2",
Right.
but he's got the strength of about 100. Do you know what I mean? He is incredibly strong, and when he gets his hands in your hair, he doesn't just give it a quick tug. He literally rips it out by the roots.
So there's
So
already a lot
that's,
of barriers to diagnosis there, isn't there?
yeah,
Okay,
yeah.
obviously in the hospital and you had to be diagnosed. What problems did you face, and what was the attitude towards you, to be honest?
Well, when it first started, the staff were really lovely. Everything was fine, but we were on the urology ward at the time.
Yeah.
Um, the problems actually started when we went on to oncology.
Right.
They tried getting him in again in the November of 2020 to do another blood test. And they gave Robert some tablets to make him sleepy, and basically they didn't work. So we had to schedule him in for another full CT scan and another full blood panel to check his tumor markers and everything, because once he'd had the operation, we basically didn't know what was going on. So we took him in the night before, got him settled as well as much as we could. He went down the next morning and he had the CT scan and he had the blood. Well, because of the time he went down, he was still quite sleepy when he came back. So we stayed in overnight again with him for safety.
Yeah.
Because if there's any problems, he can't tell with. So we stayed in overnight again for safety. The treating clinician that came in the next morning with 2 staff members. And there was me, his dad, his manager from the day centre. Obviously, Robert was in bed, and the staff members. And the treating clinician basically put the head nearly on the floor, because all I could see was the top of the head, couldn't even look us in the face, and told me that they wanted to put Robert on to community care. Well, community care basically kind of went over my head. I didn't really know what they were actually talking about.
But you had been diagnosed by now, Sharon. He had
Yes,
the testicle removed, yeah.
yes.
So how was the operation? How did you find that operation? You got through it?
It was pretty straightforward, to be honest with you. Once he'd had the testicle removed, it was just basically his wound care
Yeah.
that we had to be careful with. But I mean, he healed no problem, and he didn't actually touch the wound either.
Right. Okay.
The guy who did his operation actually sewed him up differently. The stitching was under the skin.
Yeah. Okay.
So
Yeah.
there was nothing showing once the dressings came off. So he never actually touched it, and he did pretty well, even though obviously he was sore.
Yeah.
That like I say, that operation, to be honest, was pretty straightforward.
Right.
Um,
So then you had the CT scan, and you were waiting for the results of everything that was going on. Yeah.
well, they came in, they didn't explain Robert's test results at all.
Yeah.
I kind of had to figure that out as I went along. So they were sitting, and they were saying community care, which I didn't like realize what they meant. And then I looked at them and I said, "Do you mean palliative care?" And they said, "Well, if that's what you want to call it." And I was like,
Right.
"Palliative care? Why?" And they kept saying there was nothing they could do. And they kept on repeating that. And I mean, I was hysterical by this time. I mean, I was crying. I was punching the hospital walls. I was screaming at them. I had my hands like this and I was begging them. And I mean, begging them. I was nearly on my knees, begging them to help him. And they just kept on saying, nothing we can do, nothing we can do. I looked at one of the staff members and said, why are you here? And they placed a hand on the treating clinician's shoulder, and the reply was, I'm here to support the doctor in the telling of his news. And I'm like, what? And the other learning disability nurse sat there and said nothing. I said quiet room now because like I just didn't know what to do. I mean, it was like someone had like pulled the carpet out from underneath this Phil, and you're looking at somebody in your darkest hour being told that your child's going to be dead within 12 months.
Yeah.
And you just don't know what to do. So we went down to the quiet room and we got more of the same. I ended up walking out basically because I thought I'm getting absolutely nowhere with any of this. You're not listening to me. And my brain was going, there's other hospitals, there's other, like people who deal with this type of cancer, go elsewhere. So I came out of the room and there was a staff member there openly crying in front of us. And I said, I don't know why, but I said, what's wrong with you? And they were going, oh, well, Robert. And I'm going, yes, have got him dead and buried before. Like, we even explore any type of treatment.
Yeah.
I got told to go and make myself a cup of tea and calm myself down. I won't say what my reply was to that because it wasn't very polite.
Right.
I went back down to Robert's room, started packing his bags. The staff members just vanished, don't know where they went. We were in the room with Rob, and I just said, I said to his staff member, Robert's daycare centre manager, could you go down and talk to them? Maybe it's professional to professional. They might listen to you. But he got the same response as well. They just didn't want to know because they basically thought that Robert could only have the BEP chemo.
Right.
And because
It had spread. I remember
yes,
Sharon, because we'd started talking by now, hadn't we, in the forum? It had spread. So their thinking was, well, he can't sit still for it to go because people who don't know with testicular cancer, it's BEP chemo, which is the main one.
yeah,
You have to sit for hours and hours and hours on a drip and walk around with a pole, basically a week at a time sometimes, and then you're off it for a bit, and then you're on it for another week, and then you're off it for a bit. So it goes on and on and on. So see that I remember it's obviously they found something on a CT scan that it had spread up into his lymph nodes behind his stomach.
yeah, yeah.
And
It was in his lymph behind his
so
stomach.
they've automatically gone, well, there's no way Robert, with his behavioural problems, is going to be able to have BEP. So let's just tell him there's nothing they can do, basically,
Yeah,
before
yeah,
exploring many other options,
yeah,
if at all any options.
yeah. That
Well,
they hadn't looked at any other types of chemotherapy, and they hadn't looked at any other way they could possibly get rid of it for him.
right.
I mean, I understood he couldn't have the BEP chemo because I knew he wouldn't sit to have the needles placed
Yeah.
in his hands. And I knew we couldn't get him over there to have it done because obviously, as you've just said and explained, that you're on this chemo for days and days at a time.
Yeah.
And Robert would probably pull the tubing out or the needle out, and then it would go all over. And it's poison. It's classed as like a hazardous waste.
It is. Yeah.
So I mean, can you imagine that getting onto like the nurse's skin or somebody else, or So we knew that the BEP chemo couldn't be done, but they basically looked at him and went palliative care, and that's it.
Right.
I mean, we were coming out of the hospital. We'd been discharged to palliative care, and we knew possibly that there wasn't another type of chemo out there that Robert could have. So I came home. Well, obviously I've got friends and family on my Facebook who have known Robert since he was a baby, you
Yeah.
know, like what have you. And they were all saying if it's like, what's happened, what's going on. So I ended up putting a status up on Facebook explaining to everybody that he'd been given 12 months, and just felt like people to like leave it alone because we weren't obviously coping with what had been said.
Yeah.
So
I remember you telling me, Sharon, on a sort of being ignorant a little. Well, I'll hold my hands up and thought, I'll hold my hands up myself because I know quite a bit. But when you said that it had spread and that you told me there's no way you'd be able to sit and have chemo and that, I probably thought the same as the doctor, as in, well, that's not good because this chemo works and it needs to be done. So I probably was just as ignorant. I mean, I'm not, in the position to make decisions, of course, but I remember you telling me, and I thought the same, to be honest. So, but I am not a doctor,
yeah,
and I think you remember you said, look, Phil, is there anybody you can be in touch with? I'll give you some emails to some of the top doctors, didn't I?
yes.
I wasn't passing the book. I thought, well, maybe there's something new coming out that I'm not aware of. So what you contacted other doctors?
Yes, I did. I contacted Professor Einhorn in America.
The God.
I also, he's top man, him. I also contacted Dr. Shamesh's secretary
Right,
down in London.
yeah.
This was within about an hour of you actually giving me the numbers and the emails. When I contacted Dr. Shamesh's secretary, I mean, obviously the time difference with America, it took longer for Dr. Einhorn to get back to me via email.
Yeah.
So in the meantime, I'm on the phone absolutely beside myself, basically, with stress, the worry. I mean, I was absolutely terrified.
Yeah.
Uh, I
Understandable,
rang, I rang Dr. Shamesh's secretary, and straight away they said they could treat Robert
really, within
in about an hour.
really.
Getting home from the hospital, and I mean, I was even more confused because you've got one hospital saying nothing we can do. He's got 12 months. We can't give him chemo,
Right.
and what have you. And then I'm ringing down there and I'm saying, I mean, I only verbally explained all of Robert's problems. I just said that he had autism. I didn't actually say that he had Fragile X. And she went, oh yeah, we treat people with autism all the time down here. How come they haven't offered him treatment across there? And I went, well, you tell me. I says, I don't know. I'm even more confused now. I says, because you're telling me that you can treat Robert. I did actually turn around and say to her, you're not just saying this because I'm upset.
Yeah.
And she went, God, no. She said, no. She said, we treat people with autism all the time down here. Does he have any other conditions? And I went, yeah. I says, he does actually have Fragile X syndrome. I says, but you probably don't know what that is. To which I got the reply of, oh yeah, we know what Fragile X is. We treat them all the time down here. And I'm on the phone going, what?
Yeah.
Really?
This is Dr. Shamash in Barts. Yeah.
Yeah,
Yeah.
yeah.
Or his secretary at least, yeah.
So they requested Robert's medical notes. Well, I had already asked for them anyway. It was one of the things we did before we left the hospital. I mean, I will say, Phil, being a parent of a disabled, I mean, I know he's an adult now, but he's still my child.
Of course.
Being in that room with him all that time and them carrying on the way they did, they don't realise the effect that it's had on my mental health.
Yeah.
they don't realise the effect of what they were saying to me and the way it's made me feel even now. Do you know what I mean?
Yeah.
They don't realise the effect that it's had on us as a family, the worry and the unnecessary stress that they've caused.
Yeah, but
And as we come to light now, where we're in the situation where they're saying they can treat Robert, can we have his medical notes? But we'd already asked for them anyway. But I put a status up on Facebook saying I needed help because we were in such an impossible situation, and I needed somebody to talk to who was another special needs parent who had maybe been through what we had been through with testicular cancer. And I actually found, well, a friend actually found an article of a young man called Ian Shaw. Now, Ian had been diagnosed with testicular cancer 3 years before Robert, but his had spread even more. And without any testing or anything, they told his mum that he had about a month to live and he
right.
had an infection. Now, I mean, how can you diagnose an infection in a month to live without any testing? That didn't make sense. But once I spoke to it, I spoke and managed to track it. And once I spoke to Janet, Janet actually explained that her son had had chemo, and she explained that he'd had carboplatin
Yeah.
and etoposide. And I was like, really? And she explained that the carboplatin takes about 2 hours to go through, and you can take the etoposide via a capsule straight down in the mouth. And I was like, wow. I also had a solicitor contact us as well because obviously there was a conflict of interest between us and the hospital. I mean, call it a conflict, me wanting Robert's cancer gone into for him to continue living his life and then wanting him to die. If you can call that a conflict of interest, I don't know. But once the solicitor got involved, things started moving really quickly. We got a second opinion of another treatment clinician down in London. It wasn't St. Bart's, it was the Royal Marsden. But once we got the information from them as well, we had to go to court of protection because the hospital needed permission from the courts to put Robert under the anaesthetic.
Right.
I know it sounds weird that you need permission. It's because Robert can't consent to it.
Right.
So it was like a best interest as well. We had to have another big meeting as well where there was like people involved from Robert's Day Centre, myself, the hospital staff, the solicitors and everybody to discuss the treatment as well. That lasted about 4 hours. It was the longest meeting of my life, and it was very technical as well. You know how they speak to you in, so like when the doctors are explaining something, they don't explain it in English, it's all medical.
Yeah.
Well, I had to keep putting my hand up and saying, you're going to have to tell me that in English because I don't understand what you're talking about. Plus, there's not a lot of medical people on the meeting as well. So, so once we got all that sorted out, I think they expected me to make a decision at the end of the meeting to say that I wanted Robert to have treatment. I didn't actually do that, which actually shocked the hospital, I think. And the reason I didn't do that for is because it was a lot of new information. I also had to come home and explain it all to his dad.
Yeah.
And also as well, I was very tired. I was hungry. I just wanted to go to sleep.
Yeah.
I mean, I hadn't slept for weekends, for weeks on. Do you know what I mean? And I was having a lot of nightmares as well. I was having some really vivid, horrible dreams that I won't go into. But
Well,
like I said,
I mean, I
this is
think we
the
can all
effect of
imagine, I think we can all imagine it, all that pressure. I mean, being diagnosed with cancer,
yeah,
you're basically thinking for Robert and feeling for him and doing it as someone like me can Google or whatever or go and ask the doctor. But you're doing you know you're doing all the you've done all the research, all the emailing, and all the fighting so far, and there's absolutely nothing wrong with wanting to take it all in and not just make a rash decision because you're making the decisions at the end of the day. But I'm not surprised you were tired and wound up, and
Yeah. Well, I
I would
mean,
be to be honest. It was my
got-
child,
you've got these hospital staff sitting in front of you, and I mean, I couldn't look at them. I actually had my eyes closed for the full 4 hours because I couldn't look at them.
This was at Newcastle, well, where you first diagnosed.
When I actually had the big meeting, I had to go down to his day centre because I didn't have a tablet at the time. So I
Right.
actually had to go to his day centre to do the meeting. But I couldn't look at the doctor. I just couldn't look at any of the staff because do you know what I mean? It was too much. It was like it was triggering us.
Well, I probably everybody can understand that because they told you there's nothing they can do, and then within a certain amount of period, another hospital I said, "Oh yeah, we treat people with that condition."
Yeah.
So I'm not surprised.
Uh-huh.
Look at them. I don't think I could. If it was my child personally.
Uh-huh.
No, trust has gone straight away, hasn't it, Sharon? To be honest.
Oh God. I don't even trust them now, Phil.
Yeah.
If I'm being really honest, I don't trust them because every time we're across there, they don't come in and we don't see anybody,
Right.
or they're in every 20 minutes and it feels very false.
Right.
Do you know what I mean? I mean, the staff are polite enough that they're nice enough, but I mean, we've been on some wards where the staff don't interact with Robert at all. I can't even get them in to do his obs after he's been down and had the anaesthetic and the testing done. To make sure that his blood pressure and everything's okay and his temperature and what have you. You can't even get them in to do that.
Right.
Or they're in too much. Or they come in and they don't interact with Robert, but they speak to me.
Yeah.
Robert might get a hello and then off they go.
So what happened? What you got home and it was all if you can be blunt, all the new treatment that they plan. I mean, you've been in touch with different doctors, so they decided to give you the upper top side of the carboplatin route. So who had to make that decision at the end of the day?
Well, the courts made the decision to allow Robert to have that treatment. But obviously, I think the hospital panicked because I asked for his medical notes and we stopped. Obviously, when you want medical notes, you want a second opinion.
Yeah.
So I think the hospital have went, I think we better do something about this. I mean, you shouldn't have to ask for medical notes, Phil,
Right.
for them to actually get off their backside and do some research.
True.
I mean, I don't care who they could have picked the phone up to or had a video call with. They could have had a video call with the Pope,
Yeah.
Elvis, Santa Claus. I don't care. Bloody Frosty the Snowman. I don't care. But at least I would have known that they picked the phone up and they made some effort to try and find Robert some treatment.
Yeah. Yeah.
They knew that cancer was in his lymph nodes in October.
Right.
Because when they rang me to tell us what type of cancer Robert had, they told us he had non-seminoma, which is the aggressive one.
Yeah.
When they told me that on the phone call, they actually said comfort care. Now, bearing in mind, we've just been told my disabled child's got cancer. He just had his operation, and I'm being told comfort. Well, I turned around and said on the phone, of course we're going to keep him comfortable. Me meaning pain relief because he's just had his operation. Now, when I think back, they've wanted to put him on palliative care from a week after his operation.
Yeah.
Without any more testing, without any more scans.
Right.
You know, so
you've had to chase round to get. Obviously, I wasn't there, but you've had to chase round to get Robert onto treatment and cured, when really the hospital itself should have thought Robert's got stage 2 non-salmonella. Let's ring around, see if there's any developments or there's been any cases similar that we can maybe try and cure the cancer with. But they've obviously just thought, like I said before, you know, he's not going to have BEP, so there's no point trying. That's basically what they thought. But you know, so I mean, we won't go into detail, but I don't understand why you have to go through courts, but to get on chemo. But obviously, it's because Robert can't speak for himself. It's all got to be signed and dotted, I suppose. But so you finally, how did you finally got treated in that hospital with the carboplatin and the etoposide? So how did that come around?
Well, once we found out about what treatment they were offering Robert, I mean, obviously, I mean, as you can remember, I mean, the questions that went up in the group. I mean, I was even putting questions up at 2 o'clock in the morning because I'd wake up thinking about something and think, oh, I need to ask that. So I was going into the bathroom with my phone, sitting typing a message. I mean, honest to God, at 2 o'clock in the morning, typing a message, post.
Yeah.
And then I thought, right, I posted that. And then it'll give time for people to answer us and then come back the next day and have a read of it. But half an hour later, I still couldn't sleep. So I was getting back up, going back into the bathroom, back downstairs, reading the messages on my phone. Not that I was taking anything in at 3 o'clock in the morning, because I mean, my eyes were down here. But like trying to like take in the information that was coming back. Do you know what I mean? The carboplatin goes through a lot quicker than the BEP chemo.
Yeah.
So once I figured that out, and I read up on the carboplatin, and I thought, well, it's a lower grade of chemotherapy than the BEP because they call the BEP chemo the gold standard, whereas the carboplatin for non-seminoma, they call that the bronze one.
Yeah.
You know, so once I found out a bit more about it and I thought, oh yeah, that could actually work. And then obviously I spoke to Janet, Ian's mum, and Ian had the same treatment. And I was thinking, actually, I think this could possibly work. Do you know what I mean? So I was kind of starting to see at the end of but he had to have 4 sessions of it.
Yeah.
So like every 3 weeks. So we had to have COVID testing. And the PCRs are lovely. They find your brain with that thing, you know, something. And then we obviously had to take him in. I think by the 2nd and 3rd one, it was starting to affect him. His hair was falling out.
Yeah.
He was being sick more. We had to buy a monitor in his bedroom so we could like watch him through the night. Not that I slept. Because I mean, if even so much as breathe turned over a side, I mean, I was like this, you know what I mean, on the monitor. We had a temperature gun. I've never took somebody's temperature so many times in my life in 4 months. Because it was every 15 minutes. You know, but we're doing this temperature thing.
Oh no, that's just being a caring, cautious mother.
Yeah, well, obviously Robert can't tell if he was feeling any side effects from the carboplatin. We were pouring fluids into him, so it flushed it out of his system.
Right.
He did actually manage to attend his day centre whilst he was having his chemo. But all the staff were in full PPE and they disinfected the place before we went in. But he was only there like a couple of hours to try and give him some sort of routine.
Right.
But
Obviously, this is through COVID still as well, yeah.
Yeah, well, I mean, he actually tolerated the chemotherapy extremely well.
She's a Geordie.
I think it's strong stuff. I don't know about being a Geordie. But once we got to the end of the 4th session, then we got a letter that we shouldn't have basically had from the hospital explaining that he had mature teratoma.
Right,
Now, me reading that and being not realising what it was, I thought he had lymph node cancer.
right, yeah, no, yeah.
So
But
I mean, you can imagine. I mean, I was bloody hysterical. I couldn't get hold of anybody. I'm sitting with a Macmillan card on the bed, thinking, who do I ring? And then I turned it over, and there's the Macmillan helpline.
yeah,
Help, do you know what I mean? But they explained that mature teratoma were basically that the lymph nodes were dead, and they needed removing from
right,
behind his stomach, which is why you've been re-referred back to surgery.
right. Which is quite it's not quite common, but a lot of lads with testicular cancer do have to have that operation at the end of it, because some types of testicular cancer, the chemo kills the cancer, and the lymph nodes go back to normal.
Yeah.
Sometimes the lymph nodes behind the stomach, especially, can be stopped by the chemo, but they don't shrink, or there's a slight chance that they can kick off again. And teratoma, especially, it doesn't react to chemo or radiation, so that needs to be. So a fair few lads do actually have that operation. They actually, if people who don't know, the operation, they basically cut up the stomach, take the stomach out, right, cut out all the lymph nodes that they think are cancerous, or could be teratoma, or could be in the future go back cancerous again. There's loads of different scenarios, but they cut them out, put the stomach back in, and then sew up. So there you got another challenge straight away, haven't you? Because obviously Robert's got to go and lie still for weeks on end after, because the operation is pretty severe. So that's another barrier.
That's saying I still not gonna happen.
Yeah,
Um, Well, I mean, it's actually 2 years now since Robert actually had the lymph node removed, because he was in intensive care when he had it done.
right.
He was sedated for about 4 days after the operation. That was to give a chance for the wound to heal a bit. Because he had to have, again, he had like a oxygen level monitor needle in his hand. He had an epidural in his back. He had a drip in his arm. Obviously, like the breathing tube, the nasal gastric feeding tube as well. So he had to be sedated. So he was in intensive care, and they kept him under for about 4 days.
Yeah,
Then they tried waking him up, and finally come on without the oxygen. So they went to put him back under. And as they were actually putting him under, the little Tinker Warriors pulled out the tubing. So he
right.
excavated himself. He pulled everything out. Um, he went for the needles as well, so they had to try and like bandage them really quickly, because he needed to keep them in. Once they woke him up, and he came round a lot more. He was a lot better, but he was still in intensive care.
Yeah,
We were in every day with his day centre staff, like looking after him. I mean, it was really hard coming out of intensive care and having to come home. I mean, every time he said bye, I mean that absolutely killed me. It
yeah,
really did. But he was in good hands in intensive care. Actually, can't fault staff; they were amazing. Once he came out and he went back onto urology, because they had been feeding him, and Robert has a tendency to swallow his food whole because he has dysphasia and he doesn't chew it.
yeah,
He got back onto the ward, and basically he vomited the Tyne. Yeah,
right.
the Tyne River come up, and he threw himself back over with fright, and he aspirated, and it flooded his lungs.
Right.
So within about an hour, he developed pneumonia. So, and an infection on his lungs. So he ended up back in intensive care. So he was in intensive care for about 8 days.
Right.
But they ended up taking the drip out of his hand because he wasn't tolerating it. They sedated him again, and they put a special one, so like in his arm up here,
Right.
and then bandage. I mean, the bandaged it, and the arm was about that thick with bandaging, so they could just access it from the top, and then they had the drip behind him with the tube, and because the way they had placed it, so he couldn't see the tube. So when he turned his head, he wasn't saying anything. So they actually got all the antibiotics and the fluids and everything in him via this.
Right.
And he did absolutely amazing. He never even touched it.
Right. That was a good thing, wasn't it?
Yeah, but so by the time we got him back to the ward again, he was only in about 2 days, and he was wanting to come home. Now, once he was home, he had to have white blood, not white blood cell, blood clot
Yeah. Yeah.
injections. He had to have one every day. And he had them for about 30 days.
Yeah.
Because he couldn't get up and walk. I mean, he was walking very carefully because obviously he must have known he was hurting. He wouldn't lie still on his sofa. When his brother comes in, he likes to ignore his brother and turn his back on him. So he was flipping over
Right.
on the sofa. And I mean, we were cringing when he was doing it. I'm thinking his stomach's going to burst open here, like, because I mean, do you
Yeah.
know what I mean? And I'm like, I was sitting and I'm thinking, I don't even think the pain was actually registering with them.
Right.
Do you
Obviously,
know?
yeah, I know what you mean. If he can't communicate, he can't say, it can't, will he go, out of that sort? No. Right, yeah.
No.
But obviously, when you got into this regime of etoposide and carboplatin, had the operation and it's worked so far. I mean, it's been 2 years, did you say? So that's looking good.
It'll be 3 years in October.
Right. But I find it straight. I mean, we don't have to go into great detail about it, but I'm just wondering who, if somebody rang up the hospital, you initially said we can't do anything, and gone, no, you're wrong there. You're going to get in trouble. I mean, because if this same hospital has changed its mind and said, oh, we can try this, I would just wonder who's got in touch with them. I mean, maybe I don't know, but
I
you've
don't know. Maybe it's that prick their consciences. I don't know.
but
But I
some.
mean, once the solicitor started on them, because I mean, when she
All right.
wrote,
Okay. Solicitors obviously
um,
took on the case, and
that that put a rocket up their backsides basically, because they realised that they would have to come up with some sort of like treatment plan for Robert.
did you actually
Um,
go back to them? Did you, like, after you spoke to Dr. Samash's secretary and had emails from Professor Einhorn and Huddart and that Dr. Huddart and is it Huddart?
yeah.
I'm just. Did you actually say to? I mean, I'm not blaming anybody. I'm just trying to figure out how it doesn't happen again. But did you turn around to the people at the hospital and say, "Look, I've been in touch with these doctors, and they're telling me that it can be treated," or is that what happened?
No, not at first, Phil, because I mean, they actually did a welfare call that night to see how we were.
Yeah.
And now, when I was talking to the ward staff, I didn't divulge anything. I mean, to be really honest with you, I haven't got much recollection of what they were actually saying of us, but I was just saying, yeah, no, whatever.
That's because you lost trust. That's why.
Yeah,
It's
my faith and trust in them went within seconds. It went within seconds.
Yeah, I mean, it's understandable.
Yeah,
But
you with people in a room, Phil, and I mean, there was me, the treating clinician, the two nurses, um, Robert's day centre manager, Robert's dad, and obviously Robert. There were 7 people in that room, and I felt like I was in there by myself.
I mean, when you said that somebody come in to make sure the doctor was all right because he had to give you bad news, but left you to punch walls.
I was punching the walls in front of them, Phil.
Because I mean, we knew each other by then. We knew we.
Terrified that for me acting like that. Well, I mean, obviously the road I was very distressed. Distressed is an understatement. I
Yeah.
actually got a comment off them saying if you damage any hospital property, you will pay for it. I mean, I was saying you can't do that to him. You can't treat him like that just because he's disabled. They actually threw their arms up in the air and went, don't blame me, he's got cancer. I said, I'm not blaming you that he's got cancer. What I want you to do is your job and to treat them and to help them. And
Or
it just
at least research whether somebody else with Fragile X has had that sort of treatment or an alternative treatment, or at least try. I mean, even just try and even if they just said, "Hey, let's try BEP and see how he gets on with it." Even that is trying.
Well, I mean, I know the concept chemo under anaesthetic, it's not actually possible, it's dangerous. And I knew he wouldn't sit to have the needles placed in his hands. So I knew BEP chemo wasn't an option. But as you know, dealing with testicular cancer all the time and the different types, you know that there are other types of chemo that they use, the cisplatin. I looked at that and thought maybe he could have that, and then realised that took a long time to go through the drip as well. So we ruled that one out. And then because there was non-seminoma, they used the carboplatin and etoposide for seminoma. So I didn't actually realise that they could use that for the other one as well. But the best thing was, so in the big meeting, Phil, they actually said that they weren't using the BEP as much because side effects of it was if the COVID, it was too much of a risk.
Right.
So I thought, well, if you're not doing that anyway, why haven't you looked at alternatives?
Yeah.
It just didn't make sense. Do you know what I mean? Like the whole thing just didn't make sense.
So the bigger picture above everything is Robert's got Fragile X, which is a learning difficulty, and he's got behavioural problems, which can be blunt, where he can't sit still, and he can grab and I mean, I obviously don't know the ins and outs of it. So they've found out he's got stage 2 testicular cancer and thought he can't have any treatment, especially not BEP. So he's just going to have to go away and die, right? Basically. Then you've been very, very traumatized by this. I understand that totally. We've been
I mean, it's
you were ringing me. You were ringing me or talking to me saying, asking what BEP was and asking what this was, and I would tell you. And even I thought he's not going to be able to have BEP. But I wouldn't tell you that, Sharon. Obviously, I was in the back of my mind going, if you can't sit still for 5 minutes. But then you got in touch and said, oh, and I've said, go and get second opinions, and I'll give you some emails. You've then been told that people can be treated with that type of condition with different various types of. And even I didn't know, to be honest, Sharon. You were educating me because I'd never heard of Fragile X, you know.
Yeah.
But then they've been in touch and saying, no, that can be treated. Please rattled the hospital that you initially got diagnosed with and gone, better get your arse in gear here and try this regime, which worked. You then come out the other end after the operation. You're doing all this for him. I mean, he must be absolutely tired out, but he's done the chemo. He's done the operation to get rid of the lymph nodes afterwards, which is a pretty severe operation. Now he's in remission and on surveillance. Now, what needs improving there? I mean, should there be specialist nurses for learning difficulties in cancer? Because I do know, I spoke to a lady whose daughter has got, I don't know the ins and outs of autism, Sharon, but non-verbal autism, where they sort of similar behaviour, and they've. I was talking to her about about Robert, and she goes, my daughter's 23. I hope she never gets breast cancer because there's nothing they can do. So that attitude it must be normal. That if a young lady gets breast cancer with a severe case of autism, whatever, is that the parents are thinking, "Oh, I hope they never get that because they won't treat it because she can't have the treatment."
But this is
That
one of
must be the way they think across society.
yeah, well, I mean, it completely saddens me because learning disability isn't anything new. We're not in the dark ages, Phil. It's 2020, and one of the first things Janet said to me was on the phone is, this happened with my Ian in 2017. I thought the doctors would have learned by now. Can't believe this is happening again, and it's 2020. I went, I says, I know, but when I talked to Janet, it was like light at the end of the tunnel,
Yeah,
because she was explaining to things, like talking to another special needs mom, like she understood. So like the fear and everything is what I was going through. I mean, for a normal man, being told you've got cancer is bad enough.
yeah,
Throw learning disability into the mix and it's just off the scale.
yeah.
Like I say, the hospital do not realise the actual effect that this has had on
I'll get you.
on my mental health.
I'm sure. Totally. I
You
mean,
know, you
you've
want
got.
their knowledge, you want their expertise. I mean, he hadn't just qualified as a cancer doctor. That you want their expertise. You don't want to go away as a parent and have to become a specialist in cancer without the paycheck.
Yeah, I get you. Yeah.
I don't get their paycheck. I wish I did.
So do I. But no, the thing about it, I mean, what needs if you could be what needs I mean what I found quite disturbing is I've spoken to a few people and I've spoken to you, but you know, if a young person with a condition that they don't understand what lumps are, they don't understand they've got to check their breasts or the testicles or the pains of I mean, who there isn't even. I asked you once, didn't I? Does Robert have a health checkup and do they check his testicles? Or if he was a girl, would a nurse have a quick feel of the breast to find any lumps? But and everyone
This,
says no.
this is the problem, because depending on how severe the person is with the disability, they may not allow the doctor or the nurse or whoever to actually give them a physical examination. I mean, I lost count of how many times Robert slapped the doctor's hands and what have you, and grabbed the nurse's hair and what have you, because they were just doing these observations and stuff like that. You know what I mean? So when you've
But
got it,
in this day and age, surely if you've got the parent with the chat, however they old they are, or the adults with the learning difficulty, they've got the parent, the doctor, or the nurse, three people. That's three people as a witness. So, right, I'm now going to check Robert's testicles quickly, or let's make up a name. We're going to check Jane's breast for her. Have a quick. You got the nurse. No, can't see any lumps there. I mean, if they don't even check for lumps on people who don't understand cancer of any age, really, but especially
yeah,
adults, then they're not even going to find it early. So
no,
they're going to be put in the position of the same position as you, Sharon, where it's spread, and it's
mm,
crazy, isn't it? I mean, as you
yeah,
know, I've tried to contact the government about it, and they're not interested at the minute. We'll keep at it, but I mean, what do you think? I mean, I can only probably everybody who watches this think, well done, Sharon, and Robert. Obviously, that's an unbelievable battle. We should write a book, to be honest. But above all anything, what do you think needs to improve? I.e., a nurse trained in different conditions in oncology,
well, yeah, better training and better understanding. I mean, they are introducing the McGowan training into into the hospitals now. That's become mandatory.
What's McGowan training?
But the McGowan training, there was a young man who went into hospital because he was having a seizure. And basically, the young man was autistic, but he also had cerebral palsy. Now,
Right,
from what I can understand, he was given an injection that he shouldn't have been given.
right. Okay,
It basically ended up killing him.
right, right.
Paula actually lost her son, and Paula's on my friends list, so she might actually write a comment underneath this video. But she actually got the introduction of the training introduced so that all like staff on all the hospitals, on all the wards and everywhere are trained in learning disability and in autism, which I mean is it's fantastic and it's amazing what she's done. But the thing is, so if you have got staff that are not very caring and they're being as blunt as what they were with me, do you know what I mean? Then it's going to take a lot more than training. It's going to take a whole attitude change of every NHS person that works within the NHS,
Yeah.
in all the hospitals and all the in all the different departments. Because I mean, it's not just oncology. I mean,
Oh,
you
yeah.
know, it's all the departments where they're going to need to have a lot more understanding of a disability, where the child or the adult is non-verbal, has got behaviour problems and what have you. Their attitudes need to change as well. They also need to listen to the parents, or the guardians, because they're
Hey,
actually the greatest source of information.
you know Robert better than anyone. I mean, you're that
Exactly.
you're his
And
eyes,
he's
you're his eyes on
talking
his ears, aren't you?
information. Uh-huh.
It's do you know what? It doesn't surprise me. Don't get me wrong, I love the NHS, I love the doctors and that, but it is sometimes is. I mean, to be honest, Sharon, I've had cancer. My missus is
Yeah,
there. My missus had cancer, and I had a really blunt doctor twice, Professor Ironhorn, and I prefer that. But I'm a grown man. But
yeah,
when she had cancer, her doctor would sit down and hold her hand and talk to her and say, "This is this and this is
yeah.
that." No, oh, let's really encouraging. As
Uh-huh.
I blunt, so that they can't. It depends who walks through the door. I suspect.
Yeah.
But
I mean, even if they had come in and said, look, it's stage 2, it's in his lymph nodes, this is what we would do with a regular meal. We can't do that with Rob with the chemo. Let me go away, let me consult with other colleagues, let's get some fresh eyes on this and let's see what we could do. I would have said thank you for at least trying, but there was just no faith in them whatsoever, Phil. They were defeated before they came in the door.
yeah, and understand why you got upset. I mean, it's I don't know. I don't know. It seems strange to me. I mean, I as you know, Sharon, I thought, well, he's age 2 and he's not going to be able to have Bep. And I didn't really think that there was much they could do, but then I'm not a doctor, but obviously there is something they can do, and they went about it the wrong way. So
I
you had
mean,
you had to kick
any
a bit of
parent
you had to kick a
who,
bit of arse.
yeah, well, I would say to any parent who's actually watching this video, I'll say this to you right now, just because you've been told that it's spread to the lymph nodes, don't give up, you
Yeah,
know, like try and talk to them, and if they won't talk to you, feel free to contact me through Facebook.
yeah,
Send me a message. I will reply to you. I will video call you if you want to sit and talk to you. Because at the end of the day, in that there was nobody out there who completely understood the situation I was in. People, yes, people sympathized with us, and people were shocked. But when you've got the special needs thrown into it as well, it becomes so more complicated. I mean,
yeah,
if you've got YouTube and you're watching this, go on to Will the NHS Care for Me, which is the Panorama program that I actually did last year. It's still on YouTube now. So if you just type in NHS Panorama, Will the NHS care for me? It's actually still on there now, and you can watch that as well.
Well, I'll put the links on YouTube. And on the website, because this is going on the website on YouTube. But no, well, maybe Sharon, maybe we do again in a couple of years and see how you're getting on. I mean, and I know I admire you very much. I know you've been through a hell of a lot, and I did feel a bit guilty when you told me that. I initially thought, oh, he's not they can do there, is there? So you've actually
Yeah,
educated, you've
I mean,
educated me. No,
it
because
was a pleasure.
I didn't think they'd use honestly because to be honest, they put them on carboplatin rather than cisplatin, which is easier. But I didn't know that they used it on salmonella. I always thought it was a pure salmonella. So you're educating me, and then you know the difference that the things they do in America don't get here for years. The way they treat people over there gets here eventually. So man, Craycraft said, "Oh yeah, they do sometimes use carboplatin." I wasn't aware of that. You know,
Yeah.
but but you know what I still can't get my head around now is that they're not checked for any sort of tumours when if they've
Well,
got
they do actually. I mean, Robert and Ryan, his brother, because his brother's got Fragile X as well. They do actually have like learning disability checkups at the doctors. But the problem is with Ryan, we can't actually get him to the doctors he would literally attack with. So I have to do all the questions via a telephone call. It's mad, honestly. But with Rob, they can actually get him to the doctors. So I would say if you're a special needs parent and you can't get them to the doctors for a learning disability health check, get the doctors to check them.
chat, especially
It
the
takes a couple of seconds. If the female, and they'll allow them to have a smear or a breast exam, get the doctor or the nurse to do it. If they can't, and you're having worries about them through the periods or the breasts or like the testicles or what have you, if you're not sure, request that they could possibly go into hospital, have an anaesthetic,
yeah.
and have a chest exam or a smear or a blood test, just to check that everything's okay. There's got to be more checking if disabled people, because they're just as prone to cancer as what the regular person is.
I mean,
You
yeah,
know?
that's what I can understand. It's you've already proven that a man with Fragile X can be cured of testicular cancer, or although it took you a good battle, but I can't understand whether it be women or men that the attitude still is leave them to we don't check them because they can't have treatment, so we'll leave them to die.
Yeah,
Who
basically.
and people won't check because there's probably something legally stopping them because of
As
you.
long as the parent or a carer's there and they give the doctor the legal consent to do it, then the legal doctor can, like legally the doctor can do it. Do you know what I mean?
I mean, because if Roberts was checked legally by a professional or a young girl with or a young lady with breasts is checked legally by a professional and they find it and removing the testicle, removing the breast, that's found it early and they're only stage one, they wouldn't have to go down the route you've just got had to be fight for. And the way the thinking is, well, if it has spread, we can't treat them because they can't even sit still to have chemo, so shove them.
Yeah, basically.
I don't
There's
understand
not
that,
an
Sharon. I don't know,
awful lot
not
of
this day and
people.
age, maybe the 80s and the 60s and you know,
Yeah,
not in 2023. I mean,
it's an awful attitude for medical staff to have, to be honest with you, Phil.
well, as you know, Sharon, I've written to the NHS about this and I've done meetings with them. No, nothing. I don't mean the NHS. When we say the NHS, I don't mean the doctors and the nurses. Well, in your case, it's been different. But you know what I mean? The actual people who make decisions, and because I haven't got PhD after my name and I've got the accent, oh, go away. But when I was generally saying, who's checking these people, and
Yeah.
do parents know their rights, and have parents got? Can they go to someone and say, look, my young son or my daughter are teenagers and young adults now, you know, and if we can get them diagnosed early with cancer, we can treat it. But
Yeah, well, the best thing is an early
definitely,
diagnosis might mean no chemo.
yeah. Well, I mean, an operation. I mean, I'm sure most any sort of learning difficulties. I'm sure there are ways of having operations to remove it, albeit dangerous. I understand that, but you know, would you just to say nothing we can do, go away?
Mm.
And so it isn't right in this day and age, is it? I mean, but we've done this video, and maybe we'll do it again in a couple of years or a year's time. But I know you've been through a bit of a battle legally, but we're going to do it again. We're going to do a page about autism and testicular cancer because we took it down while
Yeah,
you're going through this. But there's something that what we'll do is you've got your own group as well. I know you can always come in our group, but Sharon's in our group as well. But I know Sharon's got her own group.
yeah. Well, I set the page up for Robert, so I had all the information to hand because it was really hard trying to find something that somebody had sent us via a private message because you've got no idea how many private messages there are. I got thousands.
Yes, understand that. Yeah,
Because I have a lot of parents on my page as well who also have children with Fragile X and autism and other disabilities. So I mean the support that I got off like all of my friends who, like I say, who have got like kids with Fragile X as well I mean it was absolutely incredible. I mean it's one massive community on
well,
the on Facebook for Fragile X.
if anything, that just proves Sharon's all the battling you've done. I admire you greatly. I know everybody in the forum does, but you just you opened eyes, to be honest, and maybe even though you've had a horrible time, and Robert's had a horrible time, and emotionally and psychologically, it's been hard work. If we think about it, that
It's psychologically
really
now it's
actually
gone
opening
like
the door
that.
for people that but you have opened door. Your hard work and your effort has opened door for parents to say, "Hang on, no, that you're wrong there," and look what happened with Robert and the
Yeah,
lady, and obviously the lady before who contacted you about her son. So,
yeah,
you know, if there is one positive thing, maybe a little slightly bit, is that you bringing this to the front
mm,
and actually kicking a bit of bum is saved your son's life, obviously, but you've obviously maybe opened a little can of worms, which I'm always for, you know that. And it's also made educated, do a bit of people will look at this and go, well, they cured Robert, you know, so you're going to have a go with my son.
yeah.
It might actually save a few lives.
Hmm.
That is Robert's, you know. So I know, like you said, the psychological. I mean, it's you're taking on the psychological battles that for your son, as I'll tell you now, I've been through it twice. The psychological battles aren't nice. And even myself, and I could think for myself, if you get me. But yeah. But anyway, we'll put that up. We'll put this video up, and then we'll get all the details to it. I'll email you in a minute about getting all the links up. But yeah, but it's been really good to talk to you, Sharon. I mean, I'm glad things have turned out. Um, even though I'm sure it was a long, but that's you're a Geordie, aren't you? You're Geordie mum, so you're tough as nails. I know.
Well,
I was in
I've
the army with
sometimes
Geordies.
I get told I'm too soft to clag a hole with, you know.
I was in the army with a load of Geordies, and I don't. What do they do to you? Do they take you into the first year at school and say, right, first lesson fighting? Because they're all hard.
I can't remember.
Every Geordie I know is the most jolly person in the world, but they're all hard to fight with. I was in the army with them. If there was any hassle, the Geordies would move you out of the way and go, watch out, Scouts, we'll sort it out, Lee. Oh, yeah. But it's been great talking to you, Sharon, and yeah,
You as well, thank you.
we'll get this video up, and you can post it around as well, and hopefully
Oh
maybe
yeah, definitely.
maybe it'll open a few eyes to things that need changing, but also a parent might.
But I just want, like the medical staff when they're treating anybody with a disability, go in the room and talk to the parents. The parents are the best source of information.
Yeah,
The parent will be quite willing to work with you.
yeah,
But if you go in with an attitude like that of we're not going to help you, your child's going to die or whatever, then that kind of puts the parent on the back foot, because it kills your confidence in the staff, Phil. It
I
really does.
get that. Yeah. All right. Okay, Sharon. But thanks for talking to me. We'll get this video up. And you can put it about, and maybe it'll trigger someone somewhere to maybe act on it a little bit. But I can tell you now, all the people in our forum and all the people who admire very much for the fight that you did for your son, which was unbelievable. I mean, I wish I could have done more, to be honest. But you,
No, you did more than you know, actually, in the group as well, Phil, because I mean, you answered a frantic mother's questions as best you could.
yeah,
You know what I mean, if you had the information and I asked a question, you answered it. I mean, sometimes my questions didn't get answered, but I was asking questions more to do with Robert's disability.
yeah,
I kind of understood why they didn't get answered, because you just don't understand Robert's disability. Do you know what I mean? I mean, until I actually came on the group, I don't think the whole group and yourself had heard of Fragile X.
I don't
So,
know, have they? But to be honest, I'm a 50-year-old bloke, so I think autism is one type of illness or condition, not illness. But you're telling me, I don't know. So I've
yeah,
never.
well,
I'm-
I put it another way, Fragile X is autism with bells on it.
That's a technical. That's the technical explanation. A nice one,
Yeah,
Shannon. Thanks very much. And we'll get this sorted up in this video up, and then you can put it about a bit.
yeah, no problem, Phil. Thank
Yeah,
you very much.
you know me. Me and you always keep in touch anyway. But
Oh, yeah, definitely.
yeah, I'll
You're
email
in
you.
there, you know, love you to bits, I think you're base.
Uh,
Not weird.
I'll email you in a minute because I need to get these links for the BBC and your email and your group and everything. But in fact, just send me them. Email me all the links that you want put in front under this video.
Yeah, I'll send you the link to Robert's page, and I'll also send you the link to the Panorama program, and then obviously my email's in with it as well.
All right, Sharon.
Yeah, I'll do that sometime today, Phil, when I get 5 minutes.
All right, thanks, Sharon. See
No
you.
worries. Thanks, Phil. Bye. Bye.
Hopefully.